Good morning, everyone. Today I'm going to present our outcomes of 1,465 laparoscopic colorectal section after the implementation of Serbian National Training Program for minimal invasive colorectal surgery. So, as we know that the laparoscopic colorectal surgery has shown an improved long and short-term outcome in terms of pain, paralytic ileus, length of stay, anastomotic leak, as well as the long-term outcomes like good oncological outcome and quality of life parameters. But the laparoscopic colorectal surgery has a very long learning curve and a prolonged mentorship, and this could only be achieved with the expert supervision and the goal-oriented training, as well as the proper feedback from the trainee. So LabCo is a national training program for laparoscopic colorectal surgery in the UK. It was introduced for the specialist and the consultant in the UK to give them the highly specialized training after they finish their fellowship exam. And this was implemented because to improve the clinical outcomes, including conversion rate, mortality, and morbidity of the colorectal surgery in the UK. Then the same replica of the LabCo is introduced in the Serbia with the help of the Ministry of Health, Serbia. In this, the program of LabCo is as it is implemented in the Serbia. So the aim of our study was to report the structure of the LapSerb, as well as to report whether the LapSerb has how much benefit upon the laparoscopic colorectal surgery in the Serbia. So the method is the structured training program, LapSerb, and the outcome of the colectomy recorded in the central database managed by the Ministry of the Health, Serbia. So basically, LapSerb was a competency-based program which has the two phases. One is preclinical phase, and then it is clinical training. The preclinical training is divided into the two stages, stage 1 and stage 2. In stage 1, there is an adequate assessment of the knowledge of the colorectal surgeon. Stage 2 is the laparoscopic courses, hands-on training on the dry and the wet lab. And stage 3 is the hands-on training on the supervised hands-on training on the patients. And then in the end of every stage, there were assessment of the competencies upon every stage. So basically in this stage 1, what we did is we usually refresh the knowledge of the colorectal problems, colorectal anatomy, and the principles of the minimal invasive surgery, as well as the perioperative care of the patients, and enhanced recovery program, MDT approach, the patient and the patient safety and the human factor, and this is assessed in the end with the help of the MCQs. Stage 2 is the laparoscopic courses. Laparoscopic courses, the first is whether it is on the dry lab or the wet lab, and then there is a laparoscopic master class as well. In which there is an expert trainer from the UK fly to the Serbia to teach them the live surgery as well. And then the hands-on training and the laparoscopic skills of every surgeon is assessed by the unedited videos. And there are two assessment forms. One is global assessment form, and then the laparoscopic colorectal assessment tool. These three parameters decide at the end of the training, one of the surgeon is signed off, and the diploma of the minimal invasive surgery in the colorectal surgery is awarded by the University of Belgrade. So we analyze, after the implementation of the LabSerb, we analyze our data from January 2019 to February 2021. There were 24 delegated surgeons in this program, and it is introduced initially to the 10 centers across the country. So as far as the results are concerned, the mean age was 67 years, with the average BMI of the 25. 21% of the patients were having the previous abdominal surgeries. Most of the patients were in the ASA class 2. 83.2% of the patients were having the malignant pathology. And most of the patients were male. So most common procedure performed was the, Most common procedure performed was the anterior section, followed by the right followed by the right-sided colectomy, then the left-sided colectomy, then the APR, and then the rest of the colectomies. So at the end of the 2 years, we compared the results of the LapSerb with the LapCo, and as far as the conversion into open is concerned, it was 4.8% in the LapSerb, whereas it was 4.9% in the LapCo. 30 days readmission was 2.3% in the Serbia, whereas it was 3% in the UK. 30 days reoperation was 4.7% in the Serbia, and the 3.9% in the UK, and 30 days mortality is 1.1% in the LapSerb, whereas 0.3% in the LapCo. As for the pathological outcomes are concerned, 83% of the patients were having the malignant pathologies, in which 97.8% had the or not resection in the end. So there was certain limitation for our this analysis. The first important limitation was it was a lack of previous data because there was no central database in the Serbia initially before the LapSerb. So we couldn't compare our new data after the LapSerb to the data before the LapSerb, and long-term complications were not included in this analysis. And due to COVID, this LapSerb program were held only in the 10 tertiary care centers of the Serbia, and it was not implemented across the countries. So the LapSerb program successfully and safely established laparoscopic colorectal surgery across the Serbia with comparable and acceptable results. Outcomes are similar to the other programs as in the UK, and LapSerb has showed the standardized and competency program are essential for the colorectal training. Thank you very much. Any questions? I'm happy to answer.